Hello, my name is Stephanie Walton, and welcome to Gender Affirming Care, Barriers and Practicing Inclusivity. Today we will explore what inclusivity in healthcare looks like, why it is essential, and how we can make meaningful changes to improve the healthcare experience of transgender and gender diverse individuals. Throughout this presentation, we will follow the case study of Alex, a transgender man, and his journey through healthcare. Let's dive in to how we can make a more inclusive and compassionate healthcare environment. Quick disclaimer. The views and information presented in this project are those of the author and do not necessarily reflect the official policies of positions of Des Moines University Medicine and Health Sciences. This presentation is intended for educational purposes only and does not constitute medical advice. Inclusive healthcare is more than just using the correct terminology. It is creating an environment where all individuals, regardless of gender identity, feel respected, safe, and valued. For transgender and gender diverse individuals, inclusive healthcare can reduce barriers to care, improve health outcomes, and foster a sense of trust with a provider. Today, we will focus on disparities faced by these populations and strategies that can be adopted to make healthcare more welcoming and accessible. Let's meet Alex. He's a 24-year-old transgender man who has been navigating the healthcare system for years. Unfortunately, like many transgender individuals, Alex has encountered multiple barriers to receiving care. He has known that he is transgender since he is 16 years old. Alex has struggled for years to find a healthcare provider who understands his needs. He's encountered multiple barriers to receiving appropriate care, including discrimination, misgendering, and a lack of access to gender-affirming services, leading him to delay important health screenings. His story reflects the broader challenges that many transgender and gender-diverse individuals face when seeking healthcare. Throughout the presentation, we will discuss issues and barriers to care that Alex faced and what can be done as providers to address these. To fully understand Alex's challenges, we need to recognize the complexity of gender. Gender identity is a deeply personal experience of being male, female, both, neither, or somewhere along the gender spectrum. Gender refers to the identity that a person most aligns with, even if it differs from their sex assigned at birth. It has more to do with social constructs than physical attributes. A transgender individual is someone whose gender does not match their sex assigned at birth. A cisgender individual is someone who identifies with the sex that they were assigned at birth. A non-binary individual is someone who does not identify as exclusively male or female. Gender fluid is when a person's gender identity changes over time from one end of the spectrum to the other. A genderqueer individual is someone whose gender identity is on the spectrum between male and female. For Alex, his gender identity as a man did not match his sex assigned at birth, which created additional hurdles when interacting with the healthcare system. To review some important gender terminology, we will look at the terms that are currently used versus not in use. Gender incongruence is defined by the ICD-10 as a term that describes the experience of a difference between a patient's gender identity and the gender that is expected based on sex assigned at birth. Gender dysphoria, however, is a DSM diagnosis that relates to the distress caused by gender incongruence. While this is not experienced by all individuals, it is important to monitor for it in patients. Gender identity disorder is no longer used as a term to describe gender nonconforming individuals and was removed from the DSM in 2012 as it is outdated and implies that being gender diverse in itself is a disorder. Is gender affirming care? Gender affirming care is any medical or psychological intervention that supports a person's gender identity. This can include hormone therapy, surgery, and mental health support. These interventions assist individuals in aligning their physical appearance and gender identity, as well as improving mental and emotional well-being. One important distinction is a social versus a medical transition. Some individuals will do one, both, or neither. Let's look at Alex again. Alex began his social transition when he began to show his gender expression via clothing and hair, changing his name, and expressing his preferred pronouns. His medical transition, however, consisted of hormone therapy, such as testosterone, as well as gender-affirming surgery. After Alex received gender-affirming care, his mental health improved drastically. Gender-affirming care has been proven to reduce depression, anxiety, and suicidality, making it essential in the healthcare environment for transgender individuals. Transgender and gender diverse individuals face significant healthcare disparities, including discrimination, poorer health outcomes, and lack of access to gender affirming care. When patients are seen and receive care that is poor, it leads to reluctance to seek care in the future. A delay in care can worsen physical and mental health with transgender patients. Transgender patients are found to have higher rates of anxiety, depression, substance abuse, and suicidality compared to the general population. In order to address these inequities, there has to be intentional change in healthcare practices. The U.S. Transgender Survey is a survey conducted by the National Center for Transgender Equality and had 92,329 respondents. The data was analyzed and compiled, showing issues that transgender individuals face in many aspects of their lives. In regards to healthcare, a quarter of respondents had reported that they did not see a doctor due to issues with cost. Another quarter stated that they did not see a provider due to fear of mistreatment. Around 79% of respondents reported seeing a doctor within the last 12 months. Of those who had seen a provider in the last 12 months, one half, over 36,000, had at least one negative experience as a result of being transgender. These include being misgendered, having a provider use harsh language when treating them, or having a provider be physically rough or abusive when treating them. Many transgender and gender diverse patients having negative experiences with the healthcare system, gender affirming care greatly improves patient life satisfaction. Looking again at the U.S. Transgender Survey, it is clear the positive impact that gender affirming care has on an individual. Of individuals who had reported living as a different gender than the one assigned at birth, 79% were a lot more satisfied in their life, and 15% were a little more satisfied, resulting in an overall 94% of individuals being more satisfied after transitioning gender. Almost all individuals, 98%, who were receiving hormone therapy reported being either a lot more or a little more satisfied with their life. It was also found that an overwhelming majority, 97%, stated increased life satisfaction after at least one form of surgery for their gender identity or transition. Another area where transgender and gender diverse individuals experience disparities. They experience a disproportionate number of mental health problems compared to the general population. Studies have shown that among transgender people, 41% had a lifetime prevalence of suicide attempts, 7 to 61% reported binge drinking, and 33% reported tobacco use. These increased adverse outcomes are likely a result of stigma, discrimination, economic marginalization, violence, and dysphoria. An analysis of the 2015 U.S. Transgender Survey noted that one way to lower psychological distress was gender-affirming surgery. There were over 27,000 individuals included in the study. Of those, 12.8% had underwent gender-affirming surgery, and almost 60% had a desire to, but had not. Those who had underwent surgery had significantly lower odds of past month psychological distress, past year tobacco use, and suicidal ideations compared to those with no surgical history. Now that we have done a deeper dive into healthcare inequities, you may be asking, what can you do? One of the most important steps in providing inclusive care is building trust with transgender patients. For Alex, it was not just about the treatment, but about feeling seen and respected as a person. Simple things, such as his provider introducing themselves with their pronouns and then asking his and respecting them, went a long way. Additionally, providing a space where patients feel safe and not judged is valuable to their experience. Adding diversity and non-discrimination statements in the lobby can show patients that they are welcome at the practice. Having visible rainbow decals also promotes sensitive care, but it is important to remember to properly train staff to provide competent care. One critical aspect of inclusivity is avoiding assumptions about a person's gender identity. Instead of making guesses based on a person's appearance, ask open-ended questions such as, "How do you identify?" or "What pronouns do you prefer?" Using inclusive language such as everyone or people can help avoid reinforcing gender stereotypes and ensures that patients feel respected. Gender-neutral language is crucial for creating an inclusive healthcare environment. Using gender-neutral terms for body parts, such as chest instead of breasts, can help reduce discomfort or dysphoria in transgender patients. Going along with this, having restrooms that are gender neutral can also reduce discomfort and dysphoria in transgender patients as they don't have to decide which bathroom to go to. When asking questions, instead of asking, "How are you doing today, sir?" use a more neutral question such as, "How can I assist you today?" to ensure that all patients feel respected. As previously stated, you should not assume a person's gender identity based on how they look. If unsure on pronouns, either ask or you can use gender-neutral pronouns such as they, them. Let's talk about creating inclusive intake forms. Traditionally, these forms only ask for binary gender options, male or female, which does not really reflect the reality of many patients' experience. By adding more gender options, as well as fields for preferred names and pronouns, providers can signal that they are committed to respecting and affirming gender diversity. These forms can also mistake sex for gender, and both should be present. For Alex, an intake form that asked for his preferred name and pronouns would have immediately communicated respect and inclusivity. Another important change to intake forms is to include gender-neutral terms whenever possible. For example, instead of Latino or Latina, some individuals prefer Latinx. Including more options or having a blank space to fill in can also target this issue. Finally, ensuring patient confidentiality and allowing patients the option of whether or not to add their gender identity to their chart is very important to their experience. As previously discussed, because Alex was uncomfortable going to a provider due to poor experiences, he became behind on his screenings. This is common in transgender patients as many fall behind on screenings as a result from ignorance from a provider, patient discomfort, and discrimination. For example, screening for HIV is recommended between the ages of 13 and 64 once in a patient's life, but a study found that only 16.8% of transgender patients had had a test in the past year. According to the American Heart Association, adults over the age of 20 should have biannual cholesterol screenings. Transgender women who are on hormone therapy have been found to have higher triglyceride levels, yet oftentimes they do not get screened. All patients that have a prostate, even if on hormone therapy, should follow prostate exam guidelines as well as PSA screenings. On the same note, all patients who have not had a complete mastectomy should follow breast exam and mammogram guidelines. Patients who have a cervix should follow pap smear guidelines. One study showed that only 31% of transgender men having sex with cisgender men had had a pap smear in the last year. It is important to be compassionate and sensitive when asking about these screenings. These exams can cause discomfort and dysphoria in transgender and non-binary patients that have likely had poor experiences in healthcare. Again, remembering to use gender-neutral terminology is important, as well as offering alternatives such as self-swabbing for pap smears, which may decrease trauma and gender dysphoria. Transgender individuals like Alex often experience significant mental health challenges, especially related to gender dysphoria. Having access to mental health counseling can significantly improve emotional well-being. Alex benefited from working with a therapist who validated his experiences, offered support during his transition, and helped him navigate the societal pressures and internalized discrimination. In conclusion, after implementing the strategies learned today, Alex is more comfortable going to the clinic, knowing that he will not be judged. He was connected with proper mental health resources, and his mental health has improved greatly. After receiving gender affirming care, his gender dysphoria has decreased greatly, and he is now up to date on all of his screenings. I hope that this presentation illustrated the barriers that transgender patients face, the importance of receiving gender affirming care, and what you can do as a provider to help improve the experience of these patients. Thank you. Here are the resources that were used for this presentation. Thank you so much for your time. Please comment with any questions. Thanks for listening.